This video is about the COVID-19 pandemic and the vaccine situation in Quebec and Canada. I sent an email to the government of Quebec, but I received no response, so I'll send them both French and English versions of this video in the hopes that they see it. Same for the Canadian government. I also made a petition on change.org that I will send them, so go sign it, please. So the purpose of this video is to criticize the government of Quebec's management of the pandemic during the year 2021. The video is also directed to the government of Canada, of course, including our Prime Minister, at least the current one, Justin Trudeau, who has gone crazy with wanting to make vaccines mandatory. If you ask me, a lot of politicians and parties have lost the plot all around the world, and I have been having doubts about their judgment for this whole year, and even more in the last few weeks, I would say. Basically, I don't expect them to make the right decisions anymore.
I've given up expecting
politicians
to do the right thing.
I started doubting our government when, at the beginning of the year 2021, they implemented curfews and ridiculous fines for people not being on their property after a certain hour. There was no evidence, and there will never be evidence, that curfews prevent the spread of viruses. People are not dumb. Most people who wanted to break the rules just did it without getting caught. So you're simply punishing people who respect the rules even more, and you're pissing people off even more by taking another bit of freedom from them for no reason. So, unjustified curfews aside, the topics that I'll be covering are the following: vaccine mandates in general, and specifically for health workers in Quebec, and also travelers and federal workers. Also, mask mandates in general, and specifically for students in Quebec, and the vaccine passport in Quebec. Let's start by looking at these articles. The government of Quebec recently made vaccines mandatory for health workers. When asked about the potential consequences for workers who refuse to be vaccinated, he said his government is proposing suspension without pay. Keep in mind that in the last few years, and especially in the last 2 years, we've been having issues with lacking health workers. Well, that makes no sense. All right. Uh, as for the government of Canada, the government intends to make vaccines mandatory for federal workers in the next weeks. I imagine after the federal election is over, because they say that it's going to be at the end of September. And here's another article on this. Trudeau was asked on the campaign trail specifically whether people without a medical reason for not getting vaccinated will still be allowed to board a plane or train with accommodations. He said no. Canadians know the way to get through this pandemic is for everyone to get vaccinated. So unless people have a medical exception, they will not be able to board a plane or a train in Canada if they are unvaccinated, he confirmed. This is about protecting our young people. It's about protecting Canadians. We are absolutely unequivocal on that because this is how we get through this pandemic. So he says that it's about protecting young people, which is simply false, by the way. Uh, Remember that because I'll come back to that later. So here's what I have to say about these vaccine mandates. So you can recommend the vaccine, but you can't force people to get the vaccine. It's a fundamental right to choose what treatment you want to get. It's your body, it's your choice. If we start using this logic and you can force people to get a vaccine, then you can force anyone to get any treatment whatsoever. Using the same logic, why aren't we making it mandatory for overweight people to lose weight? We know it's one of the main reasons why people have diabetes or other systemic problems, and also, in this case, much worse outcomes with COVID. So this is why this logic doesn't make sense. All right, like you cannot force people to have a vaccine. Okay, you can't do that. Second thing about that, it seems like natural immunity is better and lasts longer than getting a vaccine. Of course, we always knew that natural immunity is quite reliable, so it makes sense to not get vaccinated in that case. For example, even back in May 2021, there was a paper that was saying basically you were going to get antibodies for a while. They said in the title for a lifetime, but uh, you know, um, it's nothing surprising. We always knew that natural immunity was very good, I guess. Oh, and by the way, a professor in the United States actually won a lawsuit so that he wouldn't have to get vaccinated. He was able to prove that he had natural immunity and that a vaccine was therefore unneeded and that it was unfair to force him to get one. There are also other lawsuits right now of that kind in the United States as well. Uh, and there's also a study that came out recently that supports the idea that natural immunity is better than vaccines and it lasts longer when it comes to COVID. So you can go read it if you're interested. I'm just going to look at a specific part of the study. If we simplify it, what they say is that natural immunity seems to be better in every way and in every case than getting 2 doses of the vaccine. But they also say that getting vaccinated as well would be a good idea. That's what they say if we keep it simple. Uh, if we go in detail in one of the part of the study, what you'll see is that they use different models. So, for example, in the model number one, they compared people who were vaccinated but never infected, and they compared these people with people who had been infected previously but never received a vaccine. So that's the people who uh, only had natural immunity. And what they say is that there was a 13 times more cases amongst vaccinated people than amongst people with natural immunity. And it's basically 2000, not 2000, 238 people in one group and 19 people in the other group for the number of cases. So that's 19 with natural immunity. And for the number of symptomatic cases, it was 191. So 191 versus 8. And for hospitalizations, it was 8 versus 1. So the numbers are always in favor of people with natural immunity. So what about the protect other people argument? So people who are vaccinated are protected and don't have to worry about people who aren't vaccinated. Okay, so people who aren't vaccinated made the conscious decision to not get vaccinated. That's their decision. Also, vaccines can help reducing transmission, but they do not prevent transmission. So you can get the virus from anyone, vaccinated or not. A good example of that is actually the Canadiens head coach, Dominic Ducharme. During the playoffs, he was the only one in the team and in the coaching staff that got COVID, or at least a positive test for COVID. So maybe it was a false positive, but basically what I'm saying is it's always possible to get COVID very easily, even if you're vaccinated, or even in an environment where it seems like no one has it. Okay, so really, the vaccine is for yourself. Also, not to forget the fact that it's true that there are associated risks with vaccines. Uh, if you're saying that the opposite, you're denying reality and established facts. So yes, it's very rare, okay, to have serious issues or to die after getting a COVID vaccine. But some people, that's what happened to them. Sadly for them. Uh, Another thing is that some people have allergies or they had previous bad experiences with vaccines, or there are also particular situations where it may be a bad idea to get a vaccine. And some other people may have other personal reasons for not getting vaccinated. So, because of that, you can't force people to get a vaccine. Also, it makes you wonder like, is it really time to force people to get a vaccine when almost everyone is vaccinated? There's about 88% of people that are is it 12 or older 12 basically they all got a vaccine in Quebec, so people are already on board, yet for some reason the governments are unsatisfied and they look like they want to control everyone. That's really messed up. Now let's talk about the vaccine passports. So it's pretty simple to me. Vaccine passports should not be a thing. If you're going to have a vaccine passport, you also have to offer the option of proving that you have immunity with a test, or prove that you are COVID free with a test once again. So, what's the point of vaccine passports in the first place? Like, we already said that vaccinated people are protected from the virus, and most people are vaccinated. So, what you're doing is you're essentially discriminating against a small percentage of people who aren't vaccinated, even though they may instead have natural immunity, and that means that it may even be better uh, immunity, like we demonstrated earlier, or at least it seems like it's better, or two, made the choice to not get a vaccine because of their personal reasons, and they are not asking to be protected by others. Once again, vaccinated people do not have to be afraid of unvaccinated people. They are protected. That's the whole point of the vaccine. If you're vaccinated and still afraid, why are you even going to public places? Like, remember, vaccines and masks do not entirely prevent transmission. Also, if the goal of vaccine passports is to prevent transmission, it doesn't make sense either. In the case where you're vaccinated but you have COVID without knowing it, that's why I just said that they don't prevent transmission. You will still be allowed in a building because you have proof of vaccination, yet you'll transmit it to other people since vaccines do not prevent transmission. Once again, see how this makes no sense? That's why I'm saying that we should be focused on the fact that vaccines are there to protect yourself and not others. So I don't know why we're pretending that it will prevent others from getting the virus from you if there's no guarantee. Not to forget that vaccinated people can also get COVID. Again, people who are not vaccinated are aware that they may get COVID. They made a choice. And finally, don't forget that having no cases of COVID is unrealistic because of how easily it gets transmitted. So, what matters is not really the number of cases, it's more the number of severe cases and hospitalizations and deaths because we care about people's health. Having a case where you have like a small cold doesn't really matter. What the purpose of vaccines was to make it possible for people to live normal lives again by being protected from the virus, even if they get it. That was the point. Now that almost everyone has been vaccinated, for some reason we still have to wear masks, which brings me to my next point. My third point is we should consider stopping using masks entirely or almost entirely right now or in the next months. So, masks, they used to make sense since they can reduce transmission, but just like vaccines, they do not entirely prevent transmission. So, at this point, if you're vaccinated or you've had COVID before, you have good protection if you get it. But that's the thing, we won't reach another level of protection. So, although some vaccinated people have severe problems with COVID, and it's generally the vulnerable people, offering vaccines to people is pretty much the only solution we have to put an end to the pandemic. Don't forget the high rates of vaccination also. Almost everyone is vaccinated. Everyone has had a chance to get vaccinated, and vaccinated people are as protected as much as currently possible, unless you have natural immunity. And we cannot force unvaccinated people to get vaccinated. Also, despite promising to college students that masks would not be mandatory if we met the target for vaccination rates, the government of Quebec decided to break their promise and make masks mandatory, even though the vaccination rates were more than satisfactory and young people are generally quite good at fighting the virus. So if I were still a college student, I would be raging right now. But still, the vaccination rates keep increasing a little, so that's a good thing, but we will never reach 100%. Okay? We have to accept that and start living life normally without masks soon. Otherwise, I have to wonder, where's the line? When will we be able to live normal lives without fear being spread by the media all the time? What will it take? Will it take children being vaccinated? Because the government, for some reason, seems to be very worried about the children because vaccines have not been approved for kids younger than 12. So they're making them wear masks for different situations. Remember when Trudeau said that it's about protecting our young people? Well, that's weird because, like I said, children and young adults are way more resilient versus COVID than older adults. Kids may even be better at dealing with COVID than vaccinated adults. So let's look at these numbers from Ontario. This is from Public Health Ontario. It's about the COVID infection in children from January 2020 to June 2021. So it's pretty much a year and a half of data. out of 70,000 cases, there were 2 kids that died. So that's 1 kid out of about 35,000, which is a little lower than 0.003%. And that number is about 200 times lower than the 0.6% death rate of the 40 to 64 years olds. And even if you look at the 18 to 39 years olds, it's 85 deaths out of 221,000 cases. So that's not that bad. It's not that bad, right? So like I said, from the looks of it, kids are even better at handling COVID than vaccinated adults. And young adults are quite good also at handling it. So just for fun, let's compare these stats to other stats. So for example, approximately 1 in 285 children in the US will be diagnosed with cancer before they are 20. So you're more than 10 times more likely to get cancer if you're under 20 years old in the US than to die from COVID in Ontario if you're under 20, not 20, but 18 years old. In the US in 2019, odds of dying from a car accident were 1 in a 107 chances and 1 in 1,128 for drowning. So it's really not that bad for kids and young adults. Oh, and by the way, if you're worried about the Delta variant for kids, here's what the CDC has to say about it, as reported by Radio Canada. So they say that the Delta variant is not worse for kids, and what we mean by that is that the cases are not much worse. So basically, they're pretty much comparable to other cases of COVID. So it's for the period from March to June, and then June to July. And what they say is this: amongst the about 3,000 kids and teens that were hospitalized before the Delta, there was about 1% of them that died. And don't forget that this is amongst hospitalized kids. So if we compare that to the Ontario numbers that we showed earlier, for 70,000 kids, they had about 400 hospitalizations and 39 in intensive care unit. So kids rarely go to the hospital because of COVID. So that's a good thing. And once again, it's 1% of the kids amongst the group of 3,000 hospitalized kids that died before the Delta variant made its entry. And 26 of them had to go to the intensive care unit. After the Delta made its entry, the numbers are a little small. So we would like a bigger sample, of course, but that's what we have. So in this case, what it says is it's less than 2% of the 164 kids that were hospitalized that died, and 23% of these 164 kids went to the intensive care unit. So it's maybe a little worse, but the difference is very small, essentially. Anyway, so if you ask me at this point, the government of Quebec should consider letting school boards and parents decide for their children what they want to do. So they can keep doing school from the computer at home if they want to, or they can send the kids to school with or without masks. They could decide. Is basically what I'm suggesting. So maybe there's another scenario I'm not thinking of, but you get the point. So we should ask the question, should kids be wearing masks? We just talked about how good kids are at fighting COVID. They are ridiculously better than adults at that. So considering that and the fact that masks cannot prevent transmission of COVID entirely, I don't think masks are beneficial enough for kids to use them. Think about it. Kids spend like 25 hours per week in the same room. I sincerely doubt that masks can prevent transmission in such a case. Remember, COVID is extremely easy to transmit, and we don't understand how transmission even happens sometimes. Remember the case of the coach, Dominique Ducharme. And in the worst case scenario, if we remove masks, is what I'm saying, if a kid gets COVID, or even if they were masked, by the way, if a kid gets COVID, or there's a breakout in school, well, the schools can just take temporary measures like they're already doing when there are cases of COVID. So removing masks, I don't think is a bad idea for kids in schools. I even think it's a good idea. So maybe for the masks, the exception would be that we could keep the masks mandatory in hospitals or other places where there are more vulnerable people. Uh, maybe for the next 3 months, maybe for the next 6 months. I don't know. But and maybe I'm forgetting other examples. But other than those, I think we should soon get rid of pretty much all the current measures. And that brings me to my next point. If we remove all the measures, we always have the option to react to a new wave of hospitalizations or deaths or severe cases with the same measures that we've used since the start of the pandemic. Of course, except the curfew. For the love of God, do not implement curfews again. So, as I was saying, the good thing is right now we've had very few deaths in the last 3 months, in Quebec, that is, and a pretty low amount of hospitalizations, especially considering the number of confirmed cases. So, for example, in August of this year, we had about 12,000 cases, a little more than that, and we had in August 13 deaths. Same thing for July, 13 deaths. In September, we're after 11 days, we have 11 deaths. So, of course, we don't like it, but it's just at some point it's not going to be possible to prevent every death. Okay. Um, And as for cases, there is about 6,000 cases in 11 days in September. So that's a little high, but what matters is severe cases, hospitalizations, and deaths. So we can look at hospitalizations as well. So in July it was 86, in August it was 300, and in September so far it's 180. So like we have some people going to the hospital for COVID, but it's not that bad, especially if you compare it to the worst months of last year. For example, let's say October last year, 1,600. November, 2,000, almost 200. December, 3,000. January, 3,000. March, 1,200. So it's really not that bad. Anyway, that's why I'm saying like it's not perfect, but it's going pretty well. So my last point is this. Um, I'm actually very disappointed with the government because they did not recommend people to become healthy. Like there was almost no effort put on encouraging people to become healthy since the beginning of the pandemic. We know that people who have poor metabolic health, so that includes overweight people, are worse at handling COVID infections. We've known that for pretty much since the beginning of the pandemic, and it's not surprising because people that are obese or overweight are they always have worse outcomes with every diseases almost. So we know that 60 about 60% of people are overweight in Canada and the US, and in a study published in 2019 in the journal Metabolic Syndrome and Related Disorders, it has been estimated that only about 12% of Americans are metabolically healthy. So for me, it's not surprising, but when we think about it, it's absolutely crazy that we are so unhealthy in North America. So considering these facts, I'm very disappointed with the government for not recommending people to lose weight. That was a really good opportunity to do that. So they could have brought in experts to explain things like the Randall cycle or how insulin works to promote weight gain so that people understand how to lose weight and obtain good metabolic health. Basically, what I'm saying is they could have hired nutritionists or physiologists to recommend different eating patterns that can help them lose uh, and or maintain a healthy weight. So why I'm focused on this is because I've spent a lot of time in the last 3 years on learning about nutrition. So that's why I'm talking about this, especially because of how the poor health of people in North America has affected the pandemic. And if we're talking about this, I'm just going to say the best example that I would recommend is simply to reduce the amount of carbohydrates you eat. Basically, you should eat a very low amounts of carbohydrates. Basically, eat a high fat, low carb diet, or at least um, low carb as much as possible. But this is a topic for another video. Okay, so as I was wrapping up this video, I stumbled upon this article. So let's talk about this as a bonus, I guess. Apparently, they are also going to use the vaccine passport for hospital visits. Like, for example, if you want to visit a family member. So, this is a prime example of the government of Quebec not making rational decisions anymore. They say that if you're not vaccinated, you are putting other patients at risk and the medical staff at risk. Once again, it is false that being vaccinated prevents catching and transmitting COVID to others. The companies who make the vaccines say that themselves. The government is simply misleading people as to what vaccines do. Also, like we already said, if you're vaccinated or you have natural immunity, you don't have to be afraid of unvaccinated people. This is why I'm saying that they lost the plot. Of course, if one of your relatives is vulnerable, no matter if you're vaccinated or not, you should get a test for COVID before visiting them, or you should consider not visiting them at all until they get better to make sure that you don't give them COVID. So I'm going to say it again. There is no guarantee that you won't give COVID to your vulnerable relatives if you've been vaccinated. Anyway, that was my criticism of our governments here in Canada. Don't forget to sign and share the petition if you live in Quebec or Canada. Thanks for watching.